Good Friday morning. Dr. Todd Bell joins me for the doctors this week, and we're talking about cold and flu season and everything going around. You're seeing some other stuff too.
Well, we are. Now it's definitely flu season,
Yes.
and at the state level we see that there's probably 35% of all the respiratory samples that are being sent to the state right now are actually influenza, and specifically influenza A. But that still leaves about 2/3 that are other things, and this is not unusual. We see this every year, that the same environmental factors that result in the flu circulating also help other respiratory viruses to circulate. So the other big one that we're seeing right now is actually RSV, so that's respiratory syncytial virus. Now, RSV, people usually think about being related to kids as a disease that affects mainly infants, and those are definitely the folks who are at greatest risk of complications from RSV, especially children who are born premature or who have chronic lung disease, children under the age of about 9 months or so, and children who have complex congenital heart disease. But you know, actually RSV causes symptoms or sickness in other folks too, and even in adults. We see that folks who have, for example, a history of emphysema, certainly some percentage of emphysema outbreaks or exacerbations of emphysema are actually caused by RSV. Now the good news is prevention is just like with any other virus. We want to stay home if folks are sick. We don't want them to spread it to other people. We want everybody to do a good job of hand washing, and we want folks just to be able to drink lots of fluids, take it easy, and don't stress their body when they're sick.
What symptoms would you look out for? Do you think this would be RSV?
So in a little baby, we look at things like certainly a cough, a lot of runny nose that goes along with RSV, and you'll see just lots and lots of boogers being produced. And then those kiddos may even have trouble breathing, so a child who's breathing too fast definitely needs to see their doctor. In older folks, it's usually milder disease. So if an adult with emphysema gets RSV, they may have a little bit of runny nose and a lot of cough, but it's usually not as severe of an illness.
The same precautions. Wash your hands, get plenty of rest, drink lots of fluids.
You got it.
Stuff. All right. Thank you, Dr. Bell.